Welcome to another season of the ASTIT podcast, where we turn science into sense. In this season, we are introducing you, our listeners, to some of the Justice Community Opioid Innovation Network, or JCOIN, family. In episodes 1 and 10, you will hear from our funder, the National Institute on Drug Abuse. And in episodes 2 through 9, you will learn about cutting-edge and recent science published by some of the investigators working in the Learning to Advance Practice, or LEAP, program, a part of JCOIN. This is so exciting. So let's get started. I'm Danielle Rudes, your host, and this is ASTIT. In this episode, we are going to unravel the complexities of state laws that affect the use of medications for opioid use disorder, MOUD, in problem-solving courts, their implications, and the need for more consistent legislation. We owe this knowledge to Barbara Andraka-Christou and colleagues, which comes from their insightful 2022 publication in the journal Health and Justice. The opioid crisis continues to ravage communities and impact individuals across the United States, prompting the need for innovative approaches to mitigate its impact. Problem-solving courts, which include drug courts, veterans courts, mental health courts, and family dependency courts, offer a rehabilitative alternative to traditional punitive justice systems. These courts aim to address the underlying substance use disorders that contribute to criminal behavior. However, not all problem-solving courts are created equal, nor do they run their everyday functions the same way, especially when it comes to their policies on medications for opioid use disorder, MOUD, which includes methadone, buprenorphine, and naltrexone, which is recognized as the gold standard in treating opioid use disorder. According to Hilary Connery, in her 2015 published paper, Medication-Assisted Treatment of Opioid Use Disorder, Review of the Evidence and Future Directions, published in the Harvard Review of Psychiatry, effective use of MOUD can reduce the spread of infectious diseases by decreasing injection drug use. Connery maintains, and Andraka-Christou and colleagues agree, that integrating MOUD into broader public health strategies can amplify its benefits and reduce the overall burden of the opioid crisis. Despite this, and its consideration as the gold standard, some courts discourage or even prohibit the use of these medications, which has led to an uneven patchwork of policies across the nation. Andraka-Christou and colleagues conducted a comprehensive survey of state laws from 2005 to 2019 to understand how legislation influences MOUD policies in problem-solving courts. They utilized Westlaw, a premier legal research software, to search for regulations and statutes that were relevant to both MOUD and problem-solving courts. The search was meticulous, focusing on terms directly associated with MOUD, such as buprenorphine, methadone, and naltrexone. Importantly, however, the search did not include brand names to ensure a broader capture of relevant laws. But before we dig into Andraka-Christou's findings, we turn first to another article by Bell and Strang from 2020 titled Medication Treatment for Opioid Use Disorder. According to this publication, methadone, a full opioid agonist, is highly effective in reducing opioid withdrawal symptoms. It has a long half-life, which helps in maintaining stable blood levels and reducing the risk of relapse. Methadone treatment has been shown to reduce illicit opioid use, decrease the risk of fatal overdose, and improve social functioning. Buprenorphine is a partial agonist, so it has a ceiling effect that reduces the risk of respiratory depression, making it safer as an alternative for some patients. It is effective in reducing opioid use and retaining patients in treatment, though retention rates are generally lower than with methadone. Naltrexone blocks the effects of opioids and is used to prevent relapse after detoxification. However, initiating treatment can be challenging due to the need for complete detoxification beforehand, and adhering to treatment can be problematic due to a lack of opioid effects, which some patients find discouraging. So now back to Andraka-Christou's findings. Their study reveals two main categories of state laws: those that prohibit problem-solving courts from banning MOUD, and those that potentially facilitate access to MOUD. Specifically, 7 states, including California, Illinois, Missouri, New Jersey, New York, Washington, D.C., and Washington, have laws that prohibit MOUD bans. These laws ensure that participants cannot be excluded from programs due to MOUD use. They cannot be forced to stop using MOUD to complete programs successfully, and cannot be limited in the type or duration of MOUD prescribed. Take California, for example, which explicitly states that using medication to treat substance use disorder should not be the sole reason for exclusion for potential pretrial diversion programs. Or Missouri, which prohibits any limits on the type, dose, or duration of MOUD prescribed to participants, ensuring all forms of MOUD are available as deemed medically appropriate by a healthcare provider. 4 states, including Indiana, Missouri, and Mississippi and New Jersey, have laws that actively facilitate MOUD access. These laws may require problem-solving courts to assess the appropriateness of MOUD for participants, mandate the availability of MOUD, or even allow courts to require MOUD treatment. Let's consider Mississippi, the state that requires courts to assess the appropriateness of MOUD for participants and mandates making court-appointed MOUD available according to National Drug Court Institute guidelines. Or we can look at Missouri again, which says that drug courts must ensure all participants are assessed for SUD, substance use disorder, using standard diagnostic criteria by a licensed physician and make MOUD available as part of their treatment plan. This research highlights a significant variation in how states address MOUD in problem-solving courts. While some states have made strides in ensuring access and preventing discriminatory practices against MOUD users, others lag, resulting in inconsistent treatment and support for individuals with opioid use disorder. Andraka-Christou and colleagues argue for the development of model state legislation to standardize MOUD policies across the nation. Such policies would ensure 3 things. 1. Prohibitions against the exclusion of participants based on MOUD use. 2. Absence of court-imposed limitations on MOUD type, dose, or duration. And 3. Mandatory referral to MOUD providers for interested participants. The future is uncertain, but if the suggested laws are implemented, it may go a long way toward helping individuals, families, and communities with substance use disorder challenges, including opioid use disorder. Then, the impact of legislation or laws that open access to MOUD and its related health outcomes for court participants would need to be studied, wouldn't it? Perhaps that will be the focus of a future episode. Let's keep moving in the direction of helping. Can we? Thank you for listening to the ACEDIT podcast. We love hearing from you. So if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write me, Danielle Rudes, at Sam Houston State University. My email is drudes@shsu.edu. And of course, thank you to the Justice Community Opioid Innovation Network, JCOIN, their Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriters on this season, Sam Houston State University doctoral students Alexa Mata and Bryce Kushmerik-McCune. And a huge and heartfelt thank you to Jason Luchin and the team at Slonky LLC for their amazing production. Tune in again soon for another episode of ACEDIT.